evening, everyone, and welcome to another episode of inspirED. I'm Sarah Loudon from Total Health Conferencing, and tonight I am joined by Dr. Shayma Kazmi of Cancer Treatment Centers of America. Before I go into Dr. Kazmi's bio, I want to say that I've had the pleasure of listening to her give a talk to a room full of co-ed medical oncologists, as well as a room full of female medical oncologists, on burnout, on balancing work-life, and the concept she introduces and the way she does it not only gives us the notion and idea that she's an expert in the field, but that she actually walks the talk. And it's really amazing to see someone who has developed such a passion for their advancement in their career while balancing their commitment to their family. And as we get going with the program tonight, really wonderful things will come up, and I hope the takeaways are ones that you all incorporate in your own lives. So Dr. Kazmi is board certified in hematology, medical oncology, and internal medicine. As I mentioned, she joined Cancer Treatment Centers of America in Pennsylvania, and this really allows her to give a holistic approach to her patient care. She is also a registered pharmacist, has served as a board member at the American Lung Association, and is a member of ASCO and ESMO. Throughout her career, Dr. Kazmi has conducted numerous cancer research studies and given many lectures on topics such as genomic testing, lung cancer, breast cancer, head and neck cancer, immunotherapy, and integrative cancer treatments. And she is passionate, which will come through tonight, about combating the rise of physician burnout across the nation. She lives in New Jersey with her husband, 3 kids, and their dog. Dr. Kazmi, for the purposes of the interview, I'd like to be able to call you Shayma and get started going a little bit deeper into who you are and what brings you to our program tonight.
Thank you so much, Sarah, for that warm welcome. I'm really excited to talk about this topic tonight. Really, really excited. Thank you.
Thank you, no problem. So as I mentioned, I've heard you give this talk in a lot of different formats, long format, short format, and to a lot of different rooms. And the first time I heard it, it was probably a 20-minute talk to a room full of women during this educational retreat that we kind of put on for women to be able to be themselves, get a lot of self-care nurturing as well as clinical concepts. And I remember thinking, like, what a magnificent topic, and the way you present it to this group. And when we were talking about having you present it at a bigger audience, men and women, I wondered how it would land and whether or not men acknowledge this level of burnout, especially in oncology. Maybe let's start there and talk about why you think this message resonates across audiences.
So for that, Sarah, let's first talk about what I mean by burnout and physician burnout, right? So I think we all want to start by defining what we're talking about. Burnout has its own definition. We all know it's characterized by an occupation-related syndrome that is filled with physical, emotional exhaustion, depersonalization, cynicism, and a low sense of professional accomplishment. When you put that in with physicians, when you talk about physician burnout, it is a vast spreading problem that is created by the way our current medicine is practiced. So while women and men are different in some respects, women and men physicians are essentially the same beast in the sense of what kind of people become physicians? People who love to give to others, people who care to give of themselves to others, who care about others over themselves at times, people who are hardworking with a tremendous work ethic, type A personalities, people who are control freaks, who want to take charge, who want to do things their way. You put all that together, and in an ideal situation, it's a beautiful thing. They're phenomenal physicians. But when the system fails them, this can become a very difficult, depersonalized situation where anxiety goes up, right? You know, when you have that tremendous sense of over accomplishment type A, anxiety levels are sky high. The concern for failure is sky high. Depersonalization, the amount of pressure we put on ourselves and everyone else is so high in a system that doesn't really work that well. And we're constantly being thrown into the ringer. So I think this syndrome affects everyone to some degree, some more than others. Some people may have found a way out of this morass, I think, of emotions and feelings, but most of us undergo some feeling of burnout at some point in our career. I'm convinced of that.
And do you think with the kind of addition of telemedicine in certain ways, of having to kind of bring work home with the pandemic, do you think that it's just growing in terms of our ability to, or our inability to separate, so that we're being more, you know, overwhelmed with work?
Absolutely. COVID pandemic has definitely thrown fuel into the fire that was already there. So I think it's affected physicians in many respects. You know, we have to talk about the fact that about 9 to 10% of physician practices have closed nationwide, likely permanently. So the financial impact on physician furloughs, layoffs, and terminations are dramatic in a field where you would never think you would have financial insecurity. You know, you go into medicine with years and years of dedication and debt, and you come out thinking, okay, I'm not going to be super rich, but I should be fairly safe and comfortable in a career that should be reliable. There isn't that reliability anymore, so the financial toll has been dramatic. Add to that, of course, this whole telemedicine idea. Medicine, to me, is a human interaction. It's a touch, it's a hug, especially in oncology. I mean, there's not a patient that I don't at least hold their hand, shake their hand, give them a hug. And we speak to patients in this physical format, and we haven't had that even with our live patients. We're avoiding touching everyone if we don't have to, right? Because of COVID. And then you throw in telemedicine. I'm looking at a patient on the screen who really just needs a comforting touch. I can't examine them, but I'm supposed to try to figure out what's going on with somebody based on merely the symptoms. It's very taxing, it's stressful, because we're afraid we'll miss something, but we don't want to yet put them at the risk of coming in and expose them. And so it's, what do? Do we make them come in? Do we not make them come in and miss something that might be going on? It's a very stressful time for patients, and physicians are really, really stressed.
And, you know, add to it physicians that have kids in school. You know, this week school started again. And it just, you know, you're balancing this new normal for them, all what they'll need that we don't even know at this point what they'll need, plus the demands of your job, plus, you know, your partner support. What are some ways that we can start to recognize when enough is becoming enough, and how to kind of not necessarily scale back, but incorporate some strategies so that we make things a little bit easier on ourselves?
I think what we need to first recognize that most of us are working at near or almost full capacity already. And so there is not a whole lot of room for error that we leave ourselves. We believe in, you know, full life, you know, work hard, play hard kind of philosophy for most of us. And it is quite fulfilling when it's balanced just perfectly, but it takes very little to throw that entire balance off. As you mentioned, you know, COVID threw that entire balance off. I have 3 children. They all go back to school actually next week. And it's going to be this hybrid virtual mix of they'll be home some days and eating lunch at almost 2 p.m. and half days. I don't even know. My head is spinning thinking about it. And people ask me, so who's going to teach your kids at home? I said, I don't know. They are. They have laptops. I'm going to work. And so really, it boils down to us being able to adapt to changes. We are As we get older, I find that adapting to change is more difficult. And with a world that is changing in the way we practice medicine, in the way we are even reimbursed, in the way that we're told what to do every week, every day, and even our home life is changing, we really have to find a way to be flexible and to learn to adapt and expect change and be ready for that. I think that's something we don't plan for. These are things we have to proactively think about. The one other thing I've also experienced is we live our life as it's thrown at us. We sort of dodging bullets. We're trying to, careen off the way when something's coming at us. We don't spend the time to proactively have a life purpose, a vision, and trying to figure out each pie of your life and really purposefully think about, are we giving enough attention to, I don't know, my religious pie, for instance, or my service, or my friends? Do I want to spend more time with them, or do I really not care about that? That's fine. I'm comfortable where we are there. How often do we sit down and analyze our life and say, okay, my work's going okay, my husband, children, spouse, life is doing okay. We don't take a temperature check on all these areas of our life routinely, ever, really, right? We just live passively as it's thrown at us and we survive, but we're not proactively living a lot of the time. So I think that's something we need to think about.
Yeah, I had a kind of a exercise and lifestyle specialist as a guest on the podcast just recently, and I just pulled up, she talked about this wellness wheel, and she talked about these areas in life: physical, intellectual, social, environmental, occupational, spiritual, and emotional. And she said that there's always a give and take, that so many times when you're feeling physically depressed, not necessarily mentally, but physically, I'm tired, I'm fatigued, I'm stressed, it's in my shoulders, it's in my legs, my back, it's because there's this imbalance of the way we're not just prioritizing, but surveying. Like, we're not saying exactly what you said, proactively saying, these are the compartments that my life is made up of, and I'm happy with the balance of each one. Shayma, do you think that that's because we're living so fast, or do you think it's just because life gets in the way and we're not giving attention to where we need to be?
Absolutely. I think our way of life in the Western world, it is a fast-paced life. We're not human beings anymore. We're human doings. If you are not doing something, it is almost something to be, laughed at or to looked at and be judged by society. If you look at social media, you don't post, I'm doing nothing video, or I'm doing a nothing Instagram. People will wonder what's wrong with you. You have to be vacationing somewhere. You have to be doing something. So this idea of being fruitful in every minute of every day and never really stopping to introspect, to take a walk, to do maybe nothing. Don't even take a walk, just sit there. Put your feet up and, take a nap. That's so frowned upon. It's a cultural issue, I think. We don't take siestas like the rest of the world does. And I think our focus on productivity and transactionalism of, RVU management and what are you worth? Your worth is based on, in a lot of institutions, how much you produce, how much money you bring in. And we have really, really lowered physicians' values and worth to a transaction. And I think that has had a huge impact on how physicians feel demoralized. There's a degree of moral injury that we're experiencing literally every minute of every day, and that erodes our soul.
You just said something, moral injury. Define that.
So it's actually defined by an erosion of the soul caused by a deterioration of one's values, dignity, spirit, and will. So what causes all that, right? when you go into a field like medicine, when you're really in the field of service of humanity, and when you actually practice medicine in today's world, what do I spend most of my days doing? A lot of times I'm fighting an administrator on how much time I need to spend with my patients. I'm fighting with an insurance company that does not want to pay for what my patient needs. Literally every minute of every day, I am documenting more often on a computer than I'm spending time looking at my patient in the eye and telling them I care. Because if I don't document this, someone isn't going to pay me and then I won't have a job. So I think that these constant erosions to what we really want to do in medicine, take care of people, the way we believe we are trained to take care of people, except that people who are not trained to do so are telling us how to do it every minute of every day. And you take physicians who are autonomous, we really, really value our autonomy. That's our pride and soul. We have trained sometimes 15 years plus to do this. And, so that I think is the moral injury that we are succumbing to that leads to physician burnout.
It's so telling. You said we've lowered physicians' value to a transaction, and it's so. I interviewed Kasha Patel, who wrote a book called, in fact, I have it here. It's so beautiful, Between Life and Death: From Despair to Hope, where he chronicles his experiences with people dying well, and tries to give this message to people that says, death isn't the end of something. And for oncologists especially, it's up to us, as much as it is up to us to cure, it's up to us to care. And to look at that person as an individual, as a father, a mother, a sister, a friend, a brother, and not just as, a genomic profile or something we can target. And he said, it's just that shift. And I think it's kind of along the same lines of what you're talking about. It's so transactional. And it's almost like to try to break out of that mold requires you breaking a system that doesn't support anything moving outside of straight ahead. So how do you see this coming to a head? I mean, it's gotta, at some point, someone's gotta take it on. How do you see that playing out?
I think the pendulum has seriously swung to an extreme at this point with the way medicine is. It's wasteful, it's expensive, and yet it isn't nearly as much quality as 20 other nations in the world who have less money than us, right? Mm-hmm. So our quality is poor. So I think at some point there has to be a way to start from scratch. I think their current system just has to be completely revised. The idea that a patient is coming in to see an oncologist just to get a chemo plan is completely missing really how medicine works and how medicine is practiced. Most of my time spent with patients are patients hungry for the human interaction. A lot of patients have difficult spousal relationships. We end up being a marriage counselor, a psychiatrist, their shoulder to cry on. We talk about their vacations, their times, their goals, their dreams. And all of those things play into the decision-making of what treatment we're going to do, because really it depends on not my goal, which is, maybe life extension and progression-free survival and overall survival. That all sounds great to me. But ask the patient. Maybe the patient would rather have a shorter lifespan, but a better one. Maybe they wouldn't trade those side effects for a few more months of life. Yeah. That discussion takes time. This is not a 15-minute transaction, as much as people would like to bring it down to that. And so medicine in general just has to come to a point where physicians get back what they have lost, their ability to treat as they deserve to treat them, and as patients deserve to be treated. They're the ones missing out in all of this.
Yeah. Shayma, do you think that institutions, academic centers, organizations like CTCA, even smaller practices, do they recognize this as an issue, and are they starting to put together programs to address it?
So absolutely, there has been more talk and more mention of physician burnout across institutions across the United States, which is a really good glimmer of hope. My institution, CTCA, has not only recognized the problem and the forefront. About 3 years ago, I had my own personal epiphany into recognizing what I diagnosed myself as essentially feeling physician burnout, but there was no word for that. I was angry, I was cynical, I was snapping, I had no patience, not for coworkers, not for my family. I was miserable. And most of the time what happens, we are labeled as that angry, entitled physician. We end up in human resources for yelling at someone, or we are just sort of looked at as, she's just got an attitude problem, in other words that women often get labeled as. And that's about it. And what was different this time is I was actually referred to a coach, an executive coach who I spoke with and I worked with. And two of us really, came up with this plan, this idea. I said, wait a minute, if you can help me, most of us are not able to get a personal coach. We don't have the time, the bandwidth, the financial wherewithal to try to afford a personal coach. Let's come up with maybe a peer support group for physicians. Now, this had never been done before in our own research. So I don't know if you know about YPO and EO. These are young professional organization and entrepreneurs organization forum groups that are held internationally by CEOs, generally speaking. So we took that model and we applied it to our 8 physician, one institution group. And we have been doing our forum meetings every 6 weeks for over 2.5 years.
Wow.
And we have been so successful. Just all of us have been really dedicated. And you would think, how do we make the time for it? It's really not an option if you see the value in it. And we created a peer coaching group at our CTCA site in Philadelphia, and we've been very successful. So I think this is something that can happen, but the most important thing is to recognize this when physicians undergo this burnout, whatever phase of burnout they may undergo. There are a variety of symptoms, Sarah. So there could be something as simple as forgetfulness, something like increased medical error rates. You could have, which just slowly you have loss of empathy for patients, your caregivers, you're more and more cynical, you're more dark. And this can just be like, oh, they're just grumpy and cranky all the time. But if you have a program that recognizes this in really one of your most important members of the hospital, which is your physician group, you may be able to find a way to have a mitigation plan. But the first most important thing is recognizing it, right? How do you?
I have a follow-up question to that. If you have a group that's able to kind of accommodate those situations, do you think that it's very much that the person themselves need to be able to be vulnerable, that they not just recognize that there's an issue, but admit to peers that there's something going on and they need the space to be able to open up? Is that hard for some people?
So you bring up a very important point. Vulnerability requires safety.
Yeah.
You cannot expect people in this kind of status and with so much to lose to be vulnerable without having safety. And safety comes with tremendous amount of anonymity and respect. So there have to be rules that have to be respected. No one is going to be vulnerable and admit to what's going on unless there is a safety plan. There is a very, very confidential program that is meant for their benefit, not meant to be punitive, not in any way meant to cause harm to their profession, right? So you really have to have a very trusting culture, which takes a while for people to truly be vulnerable. No one is going to sit there and spill their beans and tell you that things aren't going as great as they hope and they're drinking more than usual. And they're feeling bad about this whole thing and don't want to do it anymore, right?
Yeah.
So these are things that physicians undergo every single day. Physicians commit suicide on the average 1 a day. That is a sin. I mean, anyone committing suicide and losing life is a horrible thing. But the society looks at physicians as impenetrable. They've achieved what people, really wish they could achieve. They have achieved all of this, money, a great career. What are they complaining about? Is the general attitude the rest of us have, and that really needs to change. We're human. We're human just like everyone else. We feel sad, we feel overwhelmed. In what specialty do you deal with death and morbidity day in and day out and day in and day out and day in and day out, and have to come home and, make dinner and be chipper, like you didn't just lose a 29-year-old today, So
Yeah, it's very easy to identify, and and thinking about that. And you would think that systems would want to offer these types of programs, or at least nurture environments where these programs could safely exist, where it is a peer-to-peer, it is very much, an anonymous, trustworthy, where everyone is sharing. Because as you mentioned, it can affect patient care. I mean, forgetfulness, even a doctor who kind of is checked out and is like, okay, it affects patient care because, patients look to you, especially after a cancer diagnosis, to be the ones who are always hopeful and always practical. And I think that they kind of feel that when you're disconnected or, checked out in some way.
100%. I think patients know when you are not present, when you're not emotionally present. They feel it when you're not physically present, mentally present. You can really just have an emotional wall that just is a depersonalization wall built around you for self-preservation at times. And those interactions are different. So this affects, of course, patient satisfaction. Increasing error rates affects increased litigation, increased malpractice. This affects institutions financially, physician turnover. When physicians leave an institution, they cost the institution on the average $500,000 to $1 million to replace. So this is not just a make them feel better so that everyone's happy problem. This is a severe financial burden to healthcare and to institutions, which is one of the main reasons where they're starting to really recognize this as a problem, because there is really a mass exodus of physicians out of medicine, and that's really needs to stop.
Yeah, it sounds like it's a corporate responsibility, one that they definitely have to look at opportunities to fulfill, but that the physicians themselves have to be willing to kind of check themselves into the peer system to benefit. So Shayma, talk to us about, what does it look like? I mean, for those listening right now that's like, yeah, I'm a little overwhelmed. Well, who wouldn't be? It's COVID. My kid's at home. Yeah, I might, open the bottle of wine as soon as I get home now versus wait till dinner. But, reality, talk to us about what it looks like.
So I think the way to mitigate is on two fronts. You have a personal way to change the way you do what you do. I think that there's personal strategies that I think are extremely important but one of the things we talked about is having a life purpose vision check-in. Personally, don't let life just take you away and before you know it, you're retiring and where did all the time go? I didn't do half the things I wanted to do. To really have a purposeful dialogue with yourself or with your loved one about how you want your life to look now, 5 years from now, 10 years from now, and what are you working toward some kind of a goal, or are you just working for a paycheck every 2 weeks or 4 weeks? And really check into your emotional, your spiritual, your physical health, which are the 3 areas I think we ignore when we're working all the time and tending to our families. Time management is, I think, an integral part of this when we're utilizing every minute of every day to maximum and really working in that downtime, which is hard to do for a lot of us, but make it part of your day. There's so many other things that we can do. I like to outsource things that I don't really derive any pleasure from because I can afford to. Some of us can, hey, I don't want to do laundry. Do I have to? No. Can I pay someone to do it? Well, I can. It's a little bit of money. Is it worth it? To me, it is. It all depends. Do you love to cook? If you don't, you really have to find a way to outsource things and not feel guilty. I have physician friends who feel guilty getting their house cleaned by house cleaners. I said, why? If you really enjoy cleaning, that's fine. But if you don't, I think you can let somebody else do it. And you can use that time to do something else. So I think we really need to get rid of this guilt feeling of having to do everything and everything perfectly. Let go of things that we really don't want to do and we don't care about doing. So I think on the personal fronts, these are extremely important.
Yeah. You know, you think about the two audiences for our listeners right now, you know, female doctors and male doctors, very different challenges at home, stereotypically.
Yes.
But I also throw into that mix culturally. I think especially, you know, in the last 20, 30 years, when I think about my mom raising 4 kids, my mom worked overnights as a nurse. I never remember my mom saying, I'm too tired, let's order, let's go out to eat. My mom's Indian. She had a fully stocked fridge, a fully stocked pantry, cooked every day for us. And I think about when I first decided that I was going to get someone to come in and help me at home, I remember my mom saying, oh, that must be nice, but you know, it's your responsibility as a mother to be doing X, Y, and Z. I think culturally for women, it is difficult to outsource because you feel guilty that you're already giving so much time to your career. And now some of these more homey responsibilities you're giving to someone else. And for men, it's like we're supposed to be strong and capable and not need to ask for help. And, you know, we've got a stack of papers on our desk we need to complete, and, you know, dictations we didn't finish, and like all of these things. But I don't want to outsource things from my family. Can you give us a little bit of insight as to giving permission to people to do that?
So you're absolutely right. You know, I come from a traditional Indian family. My mom was a stay-home mom. I was raised in India. You know, my dad never lifted a finger in anything in the household, but his job was to earn a living and give her the money. So those were very distinct jobs, and they were defined, and it was clean, it was clear, it was almost simple, and it was okay. And now it's not that simple. It's highly complex. So I think one of the things that we do in our family is we have family meetings. We have a lot of discussion over what is it that my spouse needs more of, and what is it that I need more of. My children are now grown a little bit, 13, 11, and 7. They're perfectly capable of doing a lot more things than I give them credit for doing. I realize that I just do them partly because I have a type A personality and I want to I do it my way because it's the right way, but we have to let go of it. The dishwasher, if it's not set up the perfect way, it'll still clean the dishes. Yeah. And so I've had to let go of some of that control, and I've had to give myself permission to say, I don't need to be the perfect dishwasher or the perfect cook. I need to want to be a good doctor for my patients. I need to be a good mom to my children, which does not necessarily equal all those other things we talk about. It doesn't equal me having to clean the house or do the laundry. They couldn't care less who does the laundry. But it does require that I have that face time with my children and I spend time with them. And the way I get to do it both is by outsourcing the things that I don't value, that they don't value. And so it's really about communication with the entire family, whatever that family unit looks like. You know, if you're single, it's a different set of rules and responsibilities and obligations, and you have obligations to your parents. If you have a spouse and they have a job, I think that also requires a level of communication of what is it that you're going to do differently? What am I going to do differently? And I had to ask. For the first 5 years of my marriage, I expected everyone to do things that I saw were obvious. And I realized that we're also wired differently, men and women. What we see, if the dishes are there, we do them. If something needs to be cleaned, we do it. We replace the toilet paper because it's empty. It's not somehow built into them. And so I used to get angry about it, thinking it was just a willful neglect that was meant to hurt me. But it's not. It's really just cluelessness.
Yeah.
And so I think what I've learned to do is forgive and ask. Ask. When I needed something done without judgment, without sarcasm, without anger, just ask for someone to do it, and ask in a way that, they can say no, but then we can negotiate. Most of the times I found that everyone in the family is ready to help. You just have to learn to work as a unit and not work yourself to death, and ask.
And is that a conversation? I mean, if you're living right now with that type A, I've been doing it all myself, is that an automatic switch, or is it a conversation where you sit down and say, listen, I'm feeling something and I've got to start communicating differently?
I think it comes from lots and lots of, decompensations that I had over the years, and self-reflection, that what is this coming from? And most of the time it was being completely overwhelmed. It was to a point where I have to quit this or this or this that I love because I can't do it all. And then it was an aha moment of, why do I have to do it all? I know culturally it was defined that way. I sort of grew up that way, but who told me to do that? No one really did. I told myself. And so let's define a new rule set, in our house, which things are going to be different. And it's just is the rules that, go along in my house. It may be completely different in somebody else's house. You just have to find out what it is that you're willing to compromise on at any given time. And that also has to change over time. Mm-hmm. Things are not going to be static. My other obligations can increase. And now my children are older, they can do more things. So I think it really requires us to forgive ourselves for being overwhelmed, recognize that we are all humans and have the right to be overwhelmed. And we are not impenetrable, perfect human beings, and we need a break sometimes, and we need permission to realign our goals and how we get to do them.
Shayma, for doctors listening right now, and maybe not just doctors, but just all members of the healthcare team, is it as easy to do in practice? And do you recommend that? I mean, I recognize that I'm human and I have limits and I'm feeling overwhelmed. And so partners, let's get together and talk about it. Or team, let's, spend an hour after work and share that I'm going to have to delegate some more responsibilities. Is it as easy as that?
Well, it's not easy. I'm not going to say that this is easy. This requires a lot of self-reflection and vulnerability. They actually have surveys that actually you can take, or a group can take, to even recognize something in yourself that you may not have realized as physician burnout. Because the idea is, if you don't recognize it, and if you yourself are convinced that it's something else unrelated and you're brushing it under the carpet, then it's going to get much worse before you can even acknowledge it, and it may be too late to fix it at that point, right? So I think one of the first things we have to do is recognize that about 50 to 60% of oncologists are burnt out. And that starts right away in fellowship. So if you're saying you're not, that's amazing. I'm impressed. I mean, I want to get a playbook of your life. But if you really take some time to self-reflect on all of those symptoms of burnout, you may start realizing that, hey, I might not be so far off the deep end, but I'm beginning to feel some of these things. And once you have that recognition and that awareness, you will realize that this is not just me being cranky and really entitled and being a difficult person. This is me experiencing something that I need to address and get to the root of. And whether you sit down with your coworkers and come up with, something here isn't working. Is it the same thing for you? Maybe it is, and maybe it isn't. More often than not, we find that most of us are going through the same struggles. We're just isolated, and we don't have the time to really connect with our peers. How often do I even talk to my peers during work? I don't have the time. I got to see my patients. I got to write my notes. I got to run home to dinner for kids and do what I need to do. I don't have a minute more in my day to spend, saying, hey, how are you holding up? And so I think we need to start connecting with each other as human beings, and we realize that we're all going through very similar things.
Yeah.
And work towards some improvement strategies.
And
what we didn't talk about, Sarah, is really what an institution can do. I think on that line, really having a program that is what's called just culture. I read about that in the Stanford hospital system. And what they talk about is this idea that's completely not punitive. And it starts with having your physicians take these anonymous surveys to self-reflect on their level of burnout and satisfaction. We take surveys of patients all the time, whether they're truly satisfied with medicine. What about physicians who are really your engine that's driving the system? So these surveys can help the institution recognize the scope of the problem. And don't just have a wellness day with a massage and yoga therapist and call it, an intervention, because that's actually insulting. It really is not something that most physicians will go to, because it's not meaningful and it's not deep and it's not really well thought out. It's just really a namesake. So really, once you have these surveys, assigning a physician to be a chief wellness officer, somebody who's really in charge of having their finger on the pulse of the health of the physician team. And just the sheer fact that you consider that to be important and you value that in an institution is going to change the culture and the morale of physicians. Just the fact that you care enough about me to ask how I'm doing changes, that interaction, that relationship from a transactional relationship to one of really, a team unit. And then really having the appropriate interventions depending on what a physician needs under strict confidentiality, and really having, whether it's something as severe as, wow, you really need some time, or you need a coaching session or so because we really need some time management skills here, or your EMR skills could really use some brushing up, and you can have a couple extra hours of coaching there. Can really help your day. Or gosh, you really need an alcohol rehab program because you've really gone to a place where it's just not safe anymore. So it depends on really what the problem is that they're exhibiting. There really has to be a program that's safe, that's anonymous, that's confidential, that's going to yield a lot of help.
Do you think that we should move to introducing the concept of physician burnout as early as training, as early as medical school?
Absolutely.
Where you are starting to, you have a picture in your mind of all the things you were saying, like, I'm accomplished, I achieved my goals, I made it, whatever that it looks like. I have my career, my family, like everything's in perfect order. And then the real world is hitting and it's like, why am I feeling like this then? And reconciling those two things sometimes could probably cause guilt and, a lot of other things that make us drown out what it really is, which is being burned out. So have you seen any evidence of this starting to happen as early as medical school?
It has been reported as early as residency and fellowship training. Absolutely. And I was talking to, I teach at the Drexel Medical School, and some of the fourth-year medical students were saying they're now starting to get a couple of lectures on physician burnout, which is very good. I don't know if that it's all of the medical schools, but I agree with you that just the idea of recognizing and knowing that this problem exists and mitigate a lot of physicians feeling that guilt, that shame, that really makes a lot of them quit medicine entirely. The burden of the loans and the burden to have to make money, the burden of, I'm 10 years late to this game that the rest of my friends have already started, and now I have to perform, and gosh, I feel awful. How do I live with that? So I'm a part of a lot of physician groups, and a lot of the anonymous posts are in this area of, I'm completely burnt out. I hate this, but I don't know how I'm going to pay my bills. How do I get out of this mess? So I think it absolutely needs to start early, because this is something that's an epidemic.
Yeah, especially as you say, one a day in suicides. it is unconscionable to think that people get to that depth of feeling hopeless or helpless, that that's what they see as their way out. Shayma, what do you want people listening right now, based on all your research and your experience and exposure in physician burnout, what do you want to tell someone listening right now?
Most importantly, I want to tell them that you're not alone. If you're feeling any of these symptoms at all, and really, you don't have to quit medicine to combat some of this. I think that there are ways to really deal with a lot of these issues, and whether your institution or your partners are on board, there are absolutely individual things that you can do starting right away to try to help mitigate and identify your own personal triggers and what it is that's making you feel the way you are. And there are lots and lots of physician coaching options as well. I don't know that everyone needs to go there, but absolutely recognizing and identifying the problem and forgiving yourselves for being not perfect at all times, at all times of the day is the first step.
Mm-hmm. I think a lot of people are going to appreciate that. Before I ask you if there are any things that people can read or research on their own, I do want to say that I want to make available your talk on physician burnout that you did over this summer. I thought it was fantastic. And it was so applicable outside of medicine. I mean, so many of us right now feel burned out. It is 9 o'clock at night, right in this moment. I have been up since 6:45. I started homeschooling my 6-year-old. My 17-year-old started high school. And, thank God he's doing it on his own computer, but he's old enough to do it. But I took Joe out of school. I'm battling my own, my own struggle with my disease. I have an autoimmune disease. I'm managing a company, and I don't stop. It is 9 o'clock. And after this, I'll do my to-dos and everything else. And it's like, go to bed and wake up and I'm in the next day. And I listened to your message this summer, and it didn't only give me permission to acknowledge my feelings, but it gave me such practical strategies to be able to homeschool and have my 17 and do all of these things. So much so, Shayma, that believe it or not, I registered for a college certificate course in the last few weeks. And I said to myself, how did I find the time to do that? But it came from the root of that wellness wheel. That do I feel fulfilled? What am I doing for myself? That's the outlet. Now, some people may be like, that's not taking college classes. But for me, it is. For me, it's like, I love it, and I love the creativity of what I'm doing. And it was from your talk of giving myself permission, inventorying the things that are important to me, and saying, okay, what can I delegate? What can I just release? Things that I don't even need to hold on to anymore. What can I release? And how do I create that structure of support in my own life? And I'm not a doctor. So I feel like the principles that you teach in battling physician burnout carry over and across a lot of specialties. So I'll ask you, do you have any reading organizations, websites that you would point us to that might be able to help people along this way?
I read a lot of things. I don't know that I could tell you right off the top of my head if there's a specific source. Most of what I read initially is to make sure that all of this is validated and there's data behind it. Yeah. The strategies themselves are very unique to you. So I think that I read what suits me, and I won't read which doesn't really apply to me. So I think that everyone is very different. One can have a very spiritual mindset and read strategies that are more geared towards spirituality, or one can have I recognize what my problem is, and I'm going to read something that's more organizational. For instance, I also read a lot about financial independence, retirement early. There's a physician group called Physicians on Fire. So part of my ability to take control is to be able to have a financial future with alternate streams of income so that I can get out of this hamster wheel in the way that I can control. So I think that what you read and what you do with it, it really is not a one-stop shop. It really depends on that wheel that you identify in yourself is what's lacking. If financial freedom is what you seek to be out of this bondage, so to speak, then that's what you need to focus on. Or like I said, what I did for my 45th birthday is I got myself a personal trainer. That was my gift to myself. So to your point, I mean, who does that? Who's crazy enough to do that to themselves, right? But I said all my life, I have given. I pay attention to everyone else and have given my physical health zero.
Yeah.
I don't make time to exercise. Everyone else makes time to their activities and I don't do it. I don't make the time. So that was my gift to myself. So just like you, going back to school and taking courses, this is crazy, but it's what I'm doing and it's awesome for me to be able to do something for me. So I think it really is a very individual journey. I cannot stress that enough. Everyone's going to have their own path to what they need to do differently. And it is not a one-stop shop and it's not a one-size-fits-all.
I think it's important to say it's, as you've said, two different places, but I'm going to tie them together. It's very personal. It's very individualized, but you're not alone. What you're feeling, what you're experiencing, that level of overwhelmed, that level of what's next, what can I do? I'm losing control. You're not alone. How you address those and the strategies you use are individual to each person. And I love that you called out both things because I think those things are really important to kind of approach holistically so that you really feel like, okay, this is about me. And so I've got to start at step one, me. And that's how you get to be able to commit to the trainer or commit to the college courses because you've eliminated all those other things that are not me. It's not me anymore. Might have been me a couple of years ago, might have been me a couple months ago, but it's not me anymore moving into this next place of total healing. Well, Shayma, I have loved spending this time with you. I do always try to lighten up the mood at the end of these programs. We've all been kind of reintroducing ourselves into life, of course, safely, using masks, hand hygiene, social distancing, all these types of things. What have you missed the most that you are just bursting at the seams or recently come out and said, I'm going to do it during COVID?
Oh God, I have to say, it's so sad, but I miss being in a plane. It was ridiculous that I made American Gold status by end of February, of the year. And so I used to fly so often. It was getting to be a bit ridiculous because it was literally almost 2 to 3 times a week.
Yeah.
But it was my escape from sort of normal world. It's where I got to watch a Netflix show on my own without interruptions, where I got to go to sleep and not wake up, when I was told to, or not have a dog sitting on my head. And so I missed those moments that were just about me in an airplane or me in a hotel room and just the plane. So I missed that a lot. And no, I haven't wanting to, I'm not going on a plane yet. Even mask, not yet.
Too soon.
I'm going through some major withdrawal over there. That's what I miss the most. And vacations on a plane too.
Of course.
Just being on a plane to get away. It's just the feeling I get.
Yeah. It's so funny because during the times, I'm sure like most of us, you were saying gosh, if I have to be on one more plane, and then middle of March comes and people are like, your wish is granted, no more planes. And now we're
my husband. He said, if you get on one more plane, I don't know if this whole thing's going to work. We need you at home. And I'm like, look what happened. COVID happened.
He did it. He brought on COVID for his wish.
Like, I wish I could cook one more meal.
Well, Shayma, thank you so much for spending this time. As I mentioned, we will add on to this podcast the link for your professional talk on this. It has all the data to back things up, lists of strategies, and really helps you kind of start at A and end at Z I know that this is a passion for you. I know that it means a lot for listeners to hear that there are people that are acknowledging this. And so I just wish you the best in terms of energy and stamina and wisdom to be able to keep on fighting for this, because it matters. It matters to patient care, and it matters, you know, to all of those people who have given themselves this career to be able to feel accepted, valued, and not just looked at as a transaction. So I thank you so much for your work and for your time with us tonight.
Thank you, Sarah, for the platform. I think this is so important of you and Total Health Conferencing to really highlight, besides just the didactic stuff we do all the time, really the heart and soul of physicians need to be tended to. So thank you so much for the opportunity.
Well, thank you. Thank you. And good luck with all things. And I look forward to the time where we can be together again.
Yes, in person,
Yes.
on a plane.
Yeah, on a plane. Okay, good night, Shayma.
Good night.